quite nice with the music.
I just let you start the intro first.
Right.
Okay, guys, while we're waiting for more people to join us, we'll just give a short intro. So everyone, thanks for tuning in to our first IG live session from Oriental Remedies Clinic. Yay! It's also our first session of Ask Me Anything, aka NoonTalks with Physician Fu.
Yay!
So I'm Jaslyn. Today we have our lovely Physician Fu here. For those of you who have followed our Instagram, you would have known that she has been away for 3 weeks for a break in Japan. So welcome, Physician Fu!
Arigatou gozaimasu.
Okay. So today, right, it's actually the Noon Talk. So give a short intro on our Noon Talks. There will be a series of topics where we talk about how TCM support female health in their daily lives, as well as the major life stages that they are going to go through, say like childbirth, menopause, or other life stages okay, as well as pregnancy. So our Noon Talks will be happening on every last Wednesday of the month. So if you're interested to join us more, do mark down on your calendar. Okay, so let's see how many of you have joined. Okay, can you start? Okay, so today's topic is called Making a Baby with TCM. So Physician Fu will discuss more on how TCM help in terms of planning a pregnancy or how TCM help to conceive. Throughout the session, if you have any questions you want Physician Fu to address, do leave your questions in the chats. I will come back to that later. Okay, so before we start, first of all, Physician Fu, can you just tell us a little bit more about yourself?
Okay. Thank you, Jaslyn, for the introduction. So I'm Physician Fu. Some of you may know me, some of you may be new to me. I graduated from NTU and the Beijing University of Chinese Medicine with a double degree in Chinese medication as well as biomedical science. So I've been with ORG for a while now, and I've had experience seeing a lot of conditions, with the main focus being on fertility, family planning, female health, as well as skin conditions such as eczema, psoriasis, etc. I do see a fair number of pain conditions as well.
Although our Physician Fu looks very young, she has many patients with fertility concerns as well. So today she will be giving us more in-depth into TCM supporting the conceiving part of the woman's life. Okay, so often when we talk about conceiving, we heard about infertility. So can Physician Fu tell us a little bit more about how TCM define infertility?
Okay, so I'm sure fertility is a concern for many, especially if you're doing family planning. So the actual definition of infertility is the inability to conceive or get pregnant after 12 months of active trying without contraception. So a lot of you may now ask, what if I have been trying for like say 3 months or 6 months without contraception, but I'm not still getting pregnant, and then am I still considered infertile? Can I still come and see TCM? So although it does not technically fall within the 12 months range, you can actually still come to us for advanced nourishment and advanced preparation for your family planning. So in fact, I do actually have a lot of patients who have been trying naturally for, let's say, like 3, even less than that, a period of time, but they believe that they believe that TCM can help them in terms of family planning, so they actually are already currently seeing me.
Means not only if they have any fertility issues, even if they are still planning for a pregnancy, they can actually come to see you.
Yes, correct.
Okay. Then is there any causes that we recognize as the causes for infertility?
So the origins of infertility actually boils down to 3 main factors. So the first one is actually structural causes. So structural causes are basically structural issues with the female reproductive system. So things like polycystic ovarian syndrome, uterus or ovarian cysts and fibroids, or even blocked fallopian tubes. So this fall under the structural category lah. So other than the structural causes, right, there are also the functional causes. So things like not ovulating properly, hormonal imbalances which result in menstrual irregularities. So all this actually fall under the functional issues. Of course, this list is not extensive. There are more reasons than this lah. Yeah. And then the third one is actually the TCM causes. So the TCM causes are the ones that maybe not all of you are familiar with. So I'll just roughly go through them. So the four main TCM causes that we consider when it comes to fertility is first of all, co-womb syndrome, or it's known as Gong Han to many of you who speak Chinese. Second is the qi and blood deficiency syndrome. So this is what is known as 气血两虚. The third one is the qi and blood stagnation syndrome. So this is the 气滞血瘀, which means that the qi and the blood flow is not good inside the body. And then the last one is the kidney qi deficiency syndrome. So in Chinese it's known as the 肾气虚 lah.
Okay. Then if we want to know more in depth, right, or if we want to see if we can identify we fall into which category, is there any tips to identify?
Right, okay. So for the TCM causes, right, as usual, I would recommend everyone to get it looked at by your TCM physician, or you can come to us for a consultation to get it diagnosed more properly. But there are general guidelines that can actually help you identify which category you fall under lah. Yeah. So in terms of the TCM causes, the first one is the co-womb syndrome. Okay, so Gong Han, this is one of the easier, factors to identify. So what you do is, okay, I'm just gonna use our model over here. Okay, so you can do it at home as well. So all you need to do is actually just need to place your hand under your belly button, means on your lower abdomen near the womb area.
Is it here?
Yes, correct, somewhere here. Yeah. So this area, okay, if let's say you feel the temperature at this area compared to the temperature on your stomach area, which is above the belly button, if you feel that the temperature is significantly lower on the womb area compared to the stomach area, then most likely you have co-womb syndrome lah. Yeah. But of course, if you come over to us, we have other ways of identifying it as well, which includes measuring your basal body temperature as well as through your pulse and your lifestyle habits lah. Yeah. So that's the first one, the co-womb syndrome. For the second factor is actually the qi and blood deficiency syndrome. So for 气血两虚, this one is something that is very commonly seen in people who experience chronic fatigue. So meaning if you're someone who constantly feels tired all the time, or even if you have a prior history of anemia or low blood pressure, then this could be the main thing that is causing your infertility. Yeah. So one easy way of telling it is essentially if you look at the mirror, you look at your tongue, you stick out your tongue at the mirror, right? You realize that there are teeth marks along the edge of the tongue. So this one usually in TCM we call it a sign of qi deficiency lah. Yeah. Then for blood deficiency, yeah, so usually it happens in people with low blood pressure, anemia. So this is one easy way to tell if you suffer from the 气血两虚 syndrome, which is the qi and blood deficiency syndrome. Then the third syndrome is the 气滞血瘀 syndrome. So the qi and blood stasis syndrome. So this one is slightly different in the sense that it's not so much about the amount of qi and blood inside the body. It's more about the active flow, the healthy flow of the energy and the blood inside the body. Yeah. So some of you may be curious, how can this lead to infertility? Right. So the healthy flow of qi and blood in our body is actually very important for a lot of body functions. Yeah. So including your menstrual cycle. If you are someone who has painful menstrual cramps and you experience a lot of blood clots in your menses, right? Then there is a high chance that you have blood stasis, meaning 血瘀, which means that your blood flow is not very good, which causes the blood to tend to clump out. And then in terms of TCM, we say that 不通则痛, which means if there is a lot of congestion or clumps inside the body, right, then it can cause pain and also an imbalance of your menstrual cycle. Yeah. So that is the third syndrome. And then the last one is the kidney qi deficiency. So in TCM theory, the kidney organ is the most important organ that is related with fertility. Yeah. So if let's say your kidney qi is deficient, right, usually it manifests in the form of chronic lower back pain. Yeah. But of course, this is one of the more abstract syndromes where you most likely have to go to a TCM physician to get it diagnosed. So yeah, it's not every day everyone suddenly be like, okay, I think I am kidney qi deficient. Yeah. So it's not that common, I would say. Okay. Yeah. So these are a summary of a rough guideline of how you can tell which category you fall under. But ultimately, you want a proper, accurate diagnosis, come to us or your TCM physician to get looked at.
Okay. Yeah. So to sum up means if it's a cold womb will be lower temperature in the lower abdomen, and then qi deficiency will be chronic fatigue, and then if it's blood deficiency will be more pale.
Anemia, dizziness when you stand up, or this.
Then if it's qi and blood stagnation will be
painful menses, and also menstrual blood clots.
Whereas the kidney one will be a chronic lower back pain or go to a physician to know more.
Correct.
Yes. Since you are talking more about TCM supporting infertility, can you just let us know what TCM treatments do we have? Especially in the clinic where we provide for the patients.
Understand. Yeah. So the 3 key TCM treatments that we do for fertility is TCM herbs, acupuncture, as well as moxibustion. Yeah. So TCM herbs, it can actually help with a lot of the imbalances inside of the body. So it can do things like nourish the qi and blood inside the body. If you're someone that is deficient in both of them, it can also help to promote the active circulation of the qi and blood. Okay. If you have kidney qi deficiency, we also have herbs that can help to nourish the kidney qi. So even things that you may know like shan yao is actually very good for nourishing the kidney qi. Yeah. And then apart from that, it can actually also help to regulate your menstrual cycle, regulate your hormonal imbalances. Yeah. So to kind of improve the chances of fertility. Yeah. So that is the TCM herb side. Other than the herbs, we also have acupuncture. Yeah. So acupuncture, as we all know, involves very fine needles. Yeah. So most of the time it's not painful. Okay. But I understand that there are some people who are scared of needles. Okay. But okay, let's talk about the benefits of the acupuncture. Yeah. So sometimes I like to explain to patients that while we use the TCM herbs to nourish your body, so it's like giving your body the building blocks that it needs, while the acupuncture helps to direct all these nutrients and useful herbs towards the area that needs it most. So for example, if you're someone with Cuppage Syndrome, right, acupuncture can actually help to promote the blood circulation as well as the flow of nutrients towards the ovary area. The ovary and the womb area. Yeah. So of course, in terms of research-wise, acupuncture has also been shown to actually be able to assist with ovulation by improving the hormonal balance, as well as increasing the thickness of the uterus lining, which we all know is actually quite important for the process of implantation. Yeah. So that is acupuncture. Then the last treatment that we have is moxibustion. So moxibussion, maybe not a lot of you are familiar with it. It is called 艾灸 in Chinese. Yeah. So we basically burn the moxa stick, which is made from the herb mugwort. Okay, 就艾草. Yeah. So when we burn it near the area such as the womb area, right, it can actually provide antioxidant properties. Okay, and also help to warm up the womb, especially if you have Cuppage Syndrome. Yeah. So these are 3 main therapies that we use as frontline therapies for infertility. Yeah.
Okay. I believe this 3 is a very helpful treatment, but I'm personally a little bit scared of needles. I'm not sure if other people are scared of needles. I understand that there's a lot of benefits from the acupuncture, but let's say if there are patients who are really, really very scared of needles, is there any alternative treatments that we can offer?
Okay, so over at our clinic, right, so I understand that probably there are a lot of patients out there who share the same sentiments as Jaslyn. Yeah. So I do get also asked frequently, like, are there any alternatives to acupuncture because they are very scared of needles or they are very scared of pain. Yeah. So for us, we do have 2 alternative therapies that are completely non-invasive and also they don't involve pain. Yeah. So the first one is actually the electrolymphatic drainage therapy, which is also known as the ELT. It is a mouthful to say, but okay, basically what you need to know about the therapy is that it is a 1 hour long, completely non-invasive and painless lymphatic massage, something similar to a lymphatic massage. Okay, but instead of using manual strength, we use US FDA approved machine to go and promote the active circulation of the lymphatic system. So then some of you might ask, how can a healthy lymphatic system help with fertility? Yeah. So the lymphatic circulation, right, is actually one of the main paths through which our female hormones travel through. Right? So in terms of female hormone imbalance or even other things such as poor blood circulation, right, a healthy lymphatic circulation can actually help in both of them. And then of course, other than that, as females, we all like to detox. We all like the idea of increasing our metabolism. Yeah, and this is actually tied very closely with our lymphatic circulation. Yeah. So to summarize, basically, the ELT can actually help to improve your lymphatic drainage, which in turn can help your female hormones balance out, can help to improve your blood and T circulation if you're someone that has that issue. Okay, it can also help to improve metabolism and help with your body detox. Right? So even for patients who feel who come for general wellness, they feel very lethargic, they feel very heavy in the body. After the ELT session, they actually feel instantly rejuvenated. They feel lighter instantly. Yeah. So that is one of the painless therapy that we offer. Okay. The second one is called the negative ion therapy. Yeah. So this one is actually a technology that we brought in from Japan, and some of you may not be very familiar with the idea of negative ions. But negative ions, in other words, they are also known as antioxidants. So Justin, what is the most famous antioxidant that you know?
I think it's those from the aircon or like the fridge.
Okay, but let's talk about vitamins. Yeah. When you talk about antioxidant, what vitamin do you think about?
Vitamin C?
Yeah, okay. So antioxidant is like similar to your vitamin C. So when you think about vitamin C, you think about immunity. You think about, like boosting your immunity as well as your energy. Okay. So of course that is one of the benefits of the negative ions. Okay. But obviously for antioxidants, they have many other benefits. So one of the key benefit of antioxidants or negative ions is actually to counter oxidative stress. So oxidative stress is actually one of the main reasons of not just female infertility but also male fertility. Yeah. So oxidative stress is a very foreign term, but you can think of it as things like your pollution, okay, your daily pollution, the unhealthy food that you eat, the daily stress that you face, okay, the late nights, the exposure to all the radioactive materials, be it from your phone or your iPad or your digital devices. So even aging, okay, so all these are actually forms of oxidative stress that can make your cells age faster. And as we all know, fertility is very closely tied with age, meaning age is very time sensitive and very age sensitive, right? So the last thing that we want is for our cells, which makes up our reproductive system, to age so fast that it lowers our chances of pregnancy. Yeah. So what the antioxidants do is basically they counter that force. Yeah. So it helps to slow down this process and make aging a more healthy and regular, in a sense, normal rate in a sense. Okay. So for the negative ion, it is only a 20-minute session. Yeah, it's 20 minutes, and then it's also completely painless and non-invasive. Yeah. So we usually do combine that with our other treatments such as after ELT as well, and even do it with herbs and things like that. Yeah. So these are the two main therapies that we have that are completely painless. Yeah.
Glad to hear that there's so many treatments. So in terms of TCM treatments, we have the herbs, the acupuncture, moxibustion, and then when we go to a more tech-enhanced therapy, painless, non-invasive, we have the ELT, electrolymphatic drainage therapy, as well as the negative ion therapy.
Yeah, alright.
Okay. So I'm sure that before they try out any of the treatments, they will need to go through a consultation, right?
Right.
Yeah. So since many of us first time go to a TCM consult for family planning, is there any preparation that we need to do beforehand?
Okay. So generally, it would be good if all of you have number one, your medical test reports with you. So it doesn't have to be a very elaborate test report, but some of the key things that we want to look at for ladies would be things like blood hormone levels. So some of you may be curious which hormones we need to look at. So usually the common ones would be things like estrogen, prolactin, your luteinizing hormone, which is the LH, your follicle stimulating hormone, which is the FSH, sometimes your thyroid stimulating hormone, which is your TSH. So these are 5 main basic ones that we look at. But of course, if let's say you don't happen to, you're someone that are quite new to family planning and you don't intend to do this test immediately, you can still come and see us first, and then if we feel that it's required, then we might send you for this test. So other than that, for guys also, which we encourage to come together with your wife, you should bring along your sperm quality test. So this one is also very important for guys, because usually for guys, I would say one of the most important things would be the sperm quality. So this is a very important information that we will require. Other than all these fertility related tests, it will be good also if you can bring your medical test report of your other medical history. So for example, some patients may have uterus cysts, ovarian cysts, fibroids, or even other medical related test reports. You can feel free to bring them. So it will give us a better idea of how we can advise you. Okay. Then apart from that, also for ladies, it will be very important to have your period history with you. So I know that nowadays a lot of us, we keep application on our phone that tracks our period. So we will most likely have to have that information. You pass it to us and then we can take a look, or you just tell us verbally. So that's one of the more important things. We'll also have to know if, let's say, there has been a history of miscarriages or abortions. So this can actually affect fertility as well. So these are some things that we may require at your first consultation.
Okay. To sum up, if we are going to a consultation with any of the physicians here, so a few things to take note. You can bring along your medical reports if you have any, which is the normal blood test report for female hormones, and then for male will be on the sperm quality test, correct? And then next up, you also can provide any medical reports if you have any existing medical conditions. And also for ladies, you can also show the physicians your period history if you are keeping track of it on the application. Okay, so we also have some frequently asked questions about infertility. So if a patient is coming for a physician consult, so what can they expect on their first visit?
So usually the process will be like this. The first part will definitely be history taking as well as consultation. So we'll be asking about your period history, your medical history, as well as your lifestyle habits, whether you smoke, whether you drink regularly. So this will fall under the first consultation part. Okay. Following that, we will devise a treatment plan for you. So everyone's body and everyone's habits, everyone's lifestyle is different, right? So some of you may have to require things like acupuncture and herbs. Some of you may only require herbs. So this one we will have to devise based on your own personal lifestyle, and then we'll also let you know how often you have to come for the treatment, how long you have to come for the treatment, as well as what kind of treatments you will need. So that's the second part. And then the third part, we will be giving you lifestyle advice. So this is where we tell you, okay, you need to drink less cold drinks, okay, you need to drink less bubble tea, and you need to sleep earlier. So these are all very important things. So as I like to tell my patients, I would say that when it comes to seeing a TCM, right, 70% of the work comes from the patient side. So it's about consistency. We can only help that much, right? So lifestyle is actually very important in terms of conceiving. That's all I can say. And then the last part would be homework to take back for you. So this also comes in the 70%. So the main homework that usually we give to ladies would be the basal body temperature chart. So some of you may have heard of it before, but for those of you who are not familiar with it, it is essentially your a chart of your daily temperature when you wake up in the morning. Yeah. So usually we will tell patients, okay, you bring this chart back home, you start on cycle day 1. Okay. Then every morning when you wake up, you put your oral thermometer beside your bed. Okay. Before you even speak, before you even brush your teeth or talk to your husband, okay, you take your temperature. Okay, so if you do that consistently for 28 days or however long your cycle is, right, okay, we'll get one full basal body temperature chart of that cycle lah. Yeah. So once we have that chart, it can actually give us a lot of information about what is going on inside your body, right, or what could be the possible cause of your infertility. Yeah. So you'll let us know on whether your uterus lining is thick enough or whether it's too thin. Okay. So this one we can tell whether based on your basal body temperature lah. Okay. Usually the higher the temperature, the thicker the uterus lining. Okay. The lower the temperature, the thinner the uterus lining, which could actually impede implantation. Okay. So that's the first thing. Second thing that we also look out for is whether you're ovulating properly. Yeah. So some of you may have the ovulation sticks that you try at home. Okay, that one is fine. But we also have our way of telling ovulation. Okay, so that is when there is we look out for the ovulation spike. Which is also known as the LH surge. So if the spike is nice, and like a significant difference, right, then usually we know that ovulation is taking place regularly. Ovulation is not an issue. We can divert our attention somewhere else, right? Okay, so those are the two things that we look out for in the basal body temperature chart. Yeah. So essentially these are the 4 things that we that you can expect when you come for a TCM consultation. So this is like the process lah. On average, how much time you need? I would say anywhere between 45 minutes to 1 hour would be a good time. Yeah, it is a bit long, but we do require that amount of time to really take down your history, understand a lot more about how we can help you, and then also guide you along the way. Yeah, but that's usually for the first session. For the subsequent consultation, usually not that long. Yeah.
Okay. Next, I also have a question that we gather from the physicians. Many patients would be more curious about how the success rates like.
Okay. So I know that success rate is one of the things that a lot of people are interested to know. Okay. Of course, everyone is different. Okay, so I can only give a rough gauge based on the group that you fall under. Okay, so generally I would say if you have been naturally trying, you don't have any prior medical history, and you are under the age of 35, the chances of success are generally quite high lah. Yeah, so not much to really be worried about that lah. As I like to tell my patients, yeah, unless there really is some medical history, then that will be probably like a different. We have to look at it differently. Yeah. Then the second group of people that we look at are those who are 35 years and above, but with no prior like medical history and everything, right? Generally, I would say that the chances are there. Okay, not too bad. But we may want to start looking at combining TCM with IUI and IVF because time is running, everyone's body ages a bit differently, so some of you may require the help of like Western methods. Yeah. So the third group are those who have prior for example like structural and structural issues that are a bit harder to tackle, or those who have prior miscarriages as well as abortion history. Yeah, so these are usually the ones that I would say not that the chances are low, but we do need extra work lah. So either we have to look into do we have to address like certain issues before we even start to prepare conceiving. So if let's say it's a structural issue, do we need to do any like surgical intervention? Of course at the Western medicine side lah, not our side. Yeah, right. So everyone's success rates are a bit different lah, but generally I would say if you fall under the okay, let's say before 40 category, so far with my patients I would say average of about 7 to 8 out of 10 actually have quite good success rate. Yeah, and if of course if let's say you're 35 and younger, then the success rate will be higher than that lah. Yeah.
Okay. How about the next question we have? Would the TCM physicians advise the patients what to eat or what to avoid while they are trying to conceive?
Okay, so yeah, so this is also one of the most common questions that I get Like patients will be at the door, but then they don't want to go because they need to because they need to know. Yeah. Okay. So general guideline is of course try to reduce processed foods. Okay. Eat natural whole foods. Okay. Also cut down on cold drinks. Cut down on raw food. Okay. So raw food also includes salads, your raw vegetables. Cook them lah. You can still eat vegetables, but try and cook them. Also cut down on sashimi. Okay, so all these are not so good, especially if you're someone who has cold wound syndrome. Okay, so what to eat more of? Okay, things like we like to say black color foods because in TCM black color foods actually helps with the kidneys. So one of the more famous ones would be things like black sesame as well as black beans. Yeah, so you can incorporate them into your diet, incorporate them into your soup. That's fine. Also try to basically eat more of the natural foods instead of like the ones that have been processed a lot. Okay, then habits wise, definitely no smoking. Okay, for guys especially, you have to limit your alcohol intake as well, because all these are actually forms of oxidative stress that can impact our fertility health.
Okay. Thank you, Physician Fu. It was very insightful. Yeah. Just to let everybody who is on the live session with us, we also have a recipe on fertility coming up next week. It's also by Physician Fu. If you are interested, do check out our Instagram post next week. Yeah. So next we will go on to the Q&A session. Let me just check if there's any. Okay. First we have, how often do I need to see the physician?
So generally I would say for the first few sessions, right, you will need to see me probably, it will be a weekly thing lah. Yeah. So this one is more to for us to ensure that the herbs are doing well for you. So we usually don't prescribe too much at one go because in case let's say you have any allergy to the herbs or like it doesn't sit so well with you, then we can adjust immediately lah. Yeah. Then moving forward, let's say maybe from the first or second month onwards, right, it could be like once every 2 weeks or once every month kind of thing. So it doesn't have to be a weekly thing lah.
Okay. And then next one we have guys, do keep your questions coming. We will go to the next question. Should my husband come along for the consultation?
Yes. So usually for everyone who calls in for fertility, we do try to advise everyone to bring your spouse along because fertility is a two-person game. You need two hands to clap. Okay, so a lot of the time the issue may not necessarily be on the ladies' side lah. Okay, it could be something to do with the gents as well. So we have to take a look on both sides lah. Yeah.
Okay. Then we have, what kind of herbs do you all sell? Is this a prescription?
Yes. So we only sell prescription herbs at our clinic, and they are in powder form lah. Yeah. So which means they are not like the whole kind of like suddenly ginseng that kind, one whole stick. Yeah.
Okay.
So if let's say you are looking to get any form of herbs or even fertility herbs, right, then you do have to see our physicians for consultation first before we can prepare a personalized prescription for you lah.
Okay.
Thank you for the question.
Next up, we also have not exactly related to fertility, but is it true that you cannot take cold drinks during your period?
Okay, so as a TCM physician, so we generally advise against taking cold drinks during your period. The reason why is because cold drinks can actually lead to coldness inside the womb. Okay, so what's so bad about coldness inside the womb? Even if let's say you're not preparing for a baby, right? Okay, the coldness inside the womb can actually cause the blood circulation to freeze up. So you can think of like your blood suddenly becoming very gut lah, like very thick that kind, okay? And then it starts to form a lot of clots. Then this is where your blood stagnation comes in lah, okay? So once there is clots, right, in TCM we say 通则不痛,不通则痛, which essentially means where there is blockages, where there is congestion, it will cause pain, okay? So if let's say you don't want to suffer from chronic period pain, or if you intend to have a baby next time, or even if let's say it can even cause menstrual irregularities as well lah, because you think like the blood is like very thick now, so it's very hard to come out as well. Yeah, so sometimes you may even experience delays in periods. Yeah, so these are some of the reasons why TCM physicians will generally advise you against taking cold drinks lah. Yeah, but here I also have to address, because some patients are like, okay, they take cold drinks every day, then suddenly period they stop. This one, not much effect. Everything in moderation. Not say you cannot take at all, but you take maybe like maximum 1 to twice a week. Do your best. Even though I know Singapore is very hot.
Okay. What if the patient say I'll take some cold drinks, but also take some warming stuff to go along?
Oh, okay.
Would that be better?
Okay, hard for me to advise because no one has ever done research on what's the proper dosage for that. But general guidelines will be trying to avoid. Drink plain water or drink nice warm tea.
Okay. And then we go on to the next question. So the next one will be, if a patient successfully conceive, do they still continue with the herbs or do they stop?
Okay, so this one would be highly dependent on the patient's condition as well. So there are some patients that once they get pregnant, generally body condition is okay, then I will ask them to just stay off the herbs. But if there are patients that I feel are necessary to take the herbs, especially if in the case that they are qi and blood deficient by nature, and then when they get pregnant, right, it's an additional life form over there that they have to supply the additional nutrients. So in which case, if let's say I feel that the qi and blood deficiency or even other factors are affecting the stability of the pregnancy, then yes, I definitely will advise them to continue to take herbs throughout their pregnancy. So to answer that question, it will be yes, patients can continue to take TCM herbs even safely and effectively, so far as I've seen with all my patients. But of course it is a case by case basis.
So it's more on if the physician think it's necessary, then they will continue to take the herbs.
Yes, that's right.
Okay. So we have come to the end of our session for today. If you still have more questions for us, you can DM us and we will reply you separately. Okay, so thank you, Physician Fu, for the informative sharing. The first 3 patients, we actually have a promo for everybody. So the first 3 patients who quote the promo code ORGBABY will be able to get a complimentary consultation as well as a complimentary acupuncture for fertility concerns only. So you can call our clinic line. The number will be, give me a minute. So the number will be 8742-2163. So you can either call us or WhatsApp us to make an appointment first and quote the promo code ORGBABY, so that if you are the first 3, we will give you the complimentary treatments that I mentioned just now. So remember, it's the fastest fingers first, Okay, so you can go to any of our clinics. It doesn't have to be certain clinics. We have 4 branches, so you can just choose wherever is convenient for you. Okay, and then just to give you guys a heads up, our next topic is on our next session is on 31st May. The topic will be from bump to baby. Enjoy a safe and enjoyable pregnancy across trimester 1 to 3. So on the session itself, Physician Fu will be discussing about how TCM support the pregnancy, and also as well as giving some confinement tips, right? Yes. Okay, so if you're interested on that topic, do note down your calendar and hope to see you soon next month, last Wednesday, 31st May. Okay?
Thank you everyone for joining. Bye.